your brain is a storehouse and also a muscle. You understand? Now, a storehouse in the sense that it gathers information, and a muscle in the sense that if you exercise it, it will grow over time. So, assuming the muscle of your brain, for instance, in quotes, is 5 kg, if you begin to exercise it, after a while, it can accommodate 10 kg. After a while, it can accommodate what 50 kg. So, you must understand that there is a level of knowledge, there is a level of understanding, and then there is the level of wisdom. And then the fourth level is mastery. So this is level 1, level 2, level 3, level 4. The issue is that many of you want to jump this level to mastery. Mastery simply means you can replicate it. For instance, this lecture, I have it in my phone here. You understand? I prepared it in my tab here, but I can teach you without using this tab because everything here came from my head. And I prepared this class just yesterday to teach you today. But whatever I'm teaching it from my head, so I can keep this tab and then teach you without looking at it. But then I want to use it because it will guide me so that I will not miss anything. That's the level of mastery. But before I can operate in the level of mastery, I must understand that there are layers, there are floors. There is the first floor of knowledge, first floor of what? Understanding. The third floor is what? Wisdom. And the fourth floor is what? Mastery. So, for you to, this is where you become excellent at mastery. And this is where you can wake you up and then ask you, what are the signs of hypertensive retinopathy? You can begin to say Salus sign, bonus sign, God sign, AVDP. You can talk about them. Continue spot all those stuff because you already know this is part of it. For instance, if I tell you come and cook rice, you go and open internet and say how to boil rice. You won't. You already know it already. Why? You have mastered it over time. So to read and understand, what you need is to know first. For instance, general documentary, know it. Know it means I don't understand, but I want to just be aware. The realm of knowledge is the realm of being aware. What did I say? Being aware. So sometimes you can just read it like a storybook. Just read it. Even if you don't understand it, be reading it. Because you know you want to transit from the first layer to the fourth layer, remember? Now, this knowledge, it might take you time. It might take you 3 months. Now, that's why I told you I need to know how the brain works and how your own brain works. What I'm teaching now is how the brain works. But you now, you know how your own brain works. Some people, they will just open a book. 10 seconds, they've gotten it, Sabi? Yes. There are some people, if you open a book, 2 months, they will forget it. 2 months, they will forget about what they have read. So you must now need to now know yourself. This is what Dr. Casey was saying then, that some of you, you know you are not intelligent. But then, once there's no lecture, you go home. You need to understand how your own brain works. If you are the type that within a day or two, you've understood, you can find. Like me now, I need to read over for long before I can understand. So what I do, I now work on this principle of knowledge, understanding, wisdom, and mastery. You understand? So now, in knowledge now, I want to be aware. I want to know that there's a thing called general optometry. For instance, let's pick what topic are we going to pick now? Let's pick on fundoscopy, for instance. I want to know what fundoscopy is all about. Understanding is not my business at this range. You understand? General optometry, I want to just know what the course is talking about. So which means I might need to read it cover to cover like a storybook. If it is 100 pages, I might say, okay, today I'll read 10 pages. Just read it. Don't try to understand. If you understand the first time, it's good and fine. But don't try to understand, because if you try to understand, you are forcing the brain to work what it doesn't have. Just like me telling you that you must speak Chinese in the next 2 minutes now, and I force you, and I'm beating you, you are crying. It's not going to work. Your brain is a muscle, it takes time. You understand? So what you need is exposure. Expose yourself to that information. And the brain works by repetition. If you keep repeating that thing, exposing it to that, before you know, it will get it. You understand? So expose your brain to that information. That's why you need to start, seriously, you need to start early, on time. You read, in fact, you should read your test at 4 or 5 times for the example. By that, you will not be struggling to this and that. From of you, it's a week to exam. You now want to learn everything. That is why even if you know it, after the exam, control delete, it goes off. You do again, you play, then a week to exam, you are now in night class, killing yourself. It don't go to work that way. Do you understand? So the first realm is what? The realm of knowledge. In this realm, you want to be what? You want to be aware, not understand. Do you understand? You become aware by exposing yourself to it. You can listen to it, you can read it out and then listen to it, or you can be reading it anyhow, but just be aware that such a thing exists. After you've done it after a while, you yourself, you will know when to go to the next realm. Now, imagine maybe I've read the textbook once or twice. I feel I now know what it's talking about, but I don't understand it. I will now go to the next point of being aware, of knowledge, understanding, sorry. Understanding now, here now, beyond being aware, I want to know, oh, is this what this guy is talking about? Do you understand? Oh, is this what this guy is talking about? So, I want to now say, okay, so knowledge is spelled K-N-O-W-L-E-D-G-E. I thought before it was N-O-L-E-G-D. Knowledge. You understand? So if you understand it now, what you want to do that, you are going, your brain now is, and mind you, anything you give to your brain, it keeps it. It's not that it will fail you when you need it, but your brain is aware of, your brain is winding you. Anything you give your brain is in your brain. Just that you want it to come out under force, and your brain no dey give to anybody. It will come out when it wants to come out, if you obey the laws. You understand? So now, in understanding now, I want to now settle down. And then, okay, is this what this guy is talking about? Okay, ophthalmoscopy is 10 cm, Abby. Before you read it, now you want to have a better knowledge of it. That is what I'm saying. You want to have a better knowledge of it. It might take you some time. After you have understood it, the first stage you are aware, second stage you now understand. Then you now go to the third one, which is wisdom. Wisdom simply means applied knowledge. You have understood it. Now apply it. If you don't apply it, you will never master it. You have read on ophthalmoscope. You are aware that this is what it does. It checks the internal structures, right? You now understand that, okay, you come from 10 cm. You look at the lens, you look at the vector, you look at all this stuff. Now, you have understood it. Go and apply it. Get a colleague. Tell him, let me see. When you apply, you find out that maybe you never even knew what you were doing before. When you start to apply, you find out that it's like you jumped knowledge in the first place. You go back to knowledge again. Go and read it. Come and apply. You apply to an extent, you get stuck. You find out that, this thing I thought I understood, I don't know it. Do you understand? You go back again to apply it. Or teach it to somebody. That's why you need to have a group like this, like OSAF. You teach it to somebody. I like teaching because when I'm teaching people, not that I know them so well, I know this principle. So anything I learn, I go and teach you, but I don't impose it on you that you must learn it though. I find a forum to teach it, and once I teach it, I know it. It becomes part of me. This is the secret. You understand? So, but then, if you want to go to the fourth level, which is mastery, this level now, because you know you can do something now, and they say, come on, you are scared, because you know you got it by law. Mastery is the realm whereby anytime, any day, they call you, you can replicate it. Do you understand? So the first realm is the realm of knowledge. I want to be aware. I read it over time, continuously. Repetition. Your brain absorbs it. But you don't understand it, that's fine. The second stage is to understand. Now, I'm trying to pick up those things I've read to see if I can understand what I'm doing. Do you understand? Now, the third stage is what? Wisdom. I want to apply whatever I've learned. I want to apply transposition. I now bring questions to solve. And then the fourth stage is the mastery. The first stage is what is the mastery stage, whereby you can now replicate what you've applied over time again. So you will not say, oh, okay, I can only do ophthalmoscopy for men. I cannot do for women. No, you can replicate it over time. This is how you read and understand. So it takes time. You must be diligent in doing it to know, to understand, to apply and replicate. You understand? So this is just a by the way. This is not why I'm here. So I'm here to teach you on case history, external eye examination, and ophthalmoscopy. Are we together? So case history is a detailed yet concise biodata about a patient, which helps the doctor to conduct tests, diagnose, and treat in an efficient and effective way. Case history is a detailed yet concise biodata about a patient, which helps the doctor to conduct tests, diagnose, and treat in an efficient and effective way. Finally, case history is a detailed yet concise biodata about a patient, which helps the doctor to conduct tests, diagnose, and treat in an efficient and effective way. So what am I talking about? I'm saying that case history is detailed in the sense that you get everything you want to get, and yet it is concise. Concise means straight to the point. So a patient tells you that I'm having bloody vision. I went to Econowa, I bought tomato, and I saw the tomato was not ripe, and I dropped it, took onions. So when they were putting the onions, the water entered my eyes, and I said, okay, no wahala, let me buy water. But the water I wanted to buy, it was not cold, and I dropped it. Is this what you write in your cases? No. You will not do all those things. You will not write, okay, and I dropped the water, but it was not cold, but that guy was not shut at me. So when I looked in my eye like this, I looked like he was paining me. And I said, okay, it's like this thing have entered my eyes. You won't write all these things. You don't need them. What you need is something entered the patient's eyes, right? It happened in the market. That's what you need. So case history is detailed, yet what? Concise. Information about the patient that helps the doctor to what? Diagnose first, then what? Treat in an effective, and also refer out in an effective and efficient manner. So before you begin your case history, you must have gotten the patient's name, his age, his occupation, you understand? Date of birth, phone number, address, all those stuff. You've gotten those data, right? Yes. Now, maybe you might not be able to get them. Maybe the clerk or secretary will take, or the person will fill those forms, and then they give it to you as a doctor. Now, when it is given to you, so, and you know, in case history, your communication skill is very, very important. If you know how to communicate well, you will be a good doctor. For those of you who are shy, you might not be a very good doctor because case history or what gives you an edge is your ability to communicate. To know when to start a conversation, to know when to end it, to know when to prolong it. A patient will come and say, my son, this is started in Civil War, 1969. That time we were in Enugu. You don't know this information. But at the same time, you also want the patient to know that you care, that you listen. You just listen, then you now know when to that the people will suffer. God will bless you now. Okay, why are you here? Do you understand? They're like, no, and I'm not here for Civil War. You don't do like that. And they are not talking to you, you're pressing your phone. Okay, now try you, try. So they do like this kind of thing. No. So you must be able to know when to start a conversation, know when to stop the conversation, and know when to, okay, just give a listening ear. Some patients, they are not sick. All they need is a patient who will listen to them. They are not sick. Some, especially old patients, they are alone at home. They want to, maybe small pain, opportunity to talk, they go to hospital. You understand? So you should understand that for these patients, they are not necessarily sick. They just want someone who will listen to them. And that alone gives them relief. So your communication with patient is the most important aspect of patient care. Communication with patient is the most important aspect. And then your communication should be so good that the patient wants to have another visit. Your communication, your interaction with the patient should be so interesting that the patient who is looking forward to another class, another session with you. That's what makes you a good doctor. So it's not an opportunity to be flexible with the patient or checking the patient. You must be professional. You know you cannot check the patient. You try it and the patient reports you go for it. So you are being professional. But then in that professionalism, you should be lively. That the patient wants to have another class. He wants to have another session with you. He's looking forward to the next appointment because a medical practice will give follow-up. Come back in 2 weeks. So your first interaction with the patient should be so good that he's looking forward to the 2 weeks time. You understand? He's looking forward. Some people, 2 weeks time, that doctor, I will not go back. They will go to another hospital and they will start all over again. So you must master the art of communication. You understand? That you can And communication is a two-way thing. It's not just talking, it's also listening. You must know how to listen. Some people don't know how to listen. They only know how to talk. Why some people, they know how to listen, but they don't know how to talk. They're looking at you all through. So you should know how to listen and how to talk and balance it. You understand? So your accuracy in diagnosis, patient compliance, time taking are all hinged on good communication. So your ability to diagnose accurately, the ability to, there are some patients that their complaint is so vague, is so that you don't know what they're talking about. They are telling you so many things. In fact, they are there to confuse you. They are there to make sure that to stay in your white. So, but case history is there to make sure that you get, because from your case history you can know what the problem is. You know, because it's your case history that will tell you the test you should do. You cannot, because there are about 1 million tests in optometry. Will you do all the 1 million tests for every patient?
No.
Will you do all of them? You will not do all the 1 million tests. So you need to know how to know the test to do. And from your case history, you know that, okay, this one, I need to do this one. I need to do this one. Even though there are tests you must do for every patient. There are tests you must do for every patient, you understand? And there are tests you must do for every patient. So your ability, please, this is a live class, and I don't want you to come here to disrupt my class. Put your phone on silent. It's being recorded. Put your phone on silent. I don't want to see your phone. I don't want to hear the sound. Are you hearing me? I don't want to see your phone. I don't want to hear the sound of your phone. And you are distracting me. Every year you are already distracting me. So just enter quietly and sit down. So where was I? See what I don't want. So your ability to diagnose accurately is dependent on your cases. From the chief complaint, you can even know what the problem is. But never assume from the chief complaint that, oh, you say I cannot see near print. Oh, correct the here. Come and collect the glass. Don't assume. But your chief complaint will give you idea of where you are going to. You understand? So your ability to diagnose effectively is hinged on a good case system. And again, there are some patients that they will never comply quickly. Look up, they are looking down. Look here. If you tell them up, they will do the opposite down. If you say look straight, they will look on that. So most times, patient compliance can be managed, can be stage managed well if you have a good rapport with your patients. You understand? So when your patient trusts you and he is confident that I'm in the right hand, whatever I tell him to do, he will do it. But if your patient comes and then he assesses you, you are dressing indecently, you appear wayward, he's like, let me do and go, and not trust this. Like for instance, if you have a patient like my father, and your hair is rough, he will never trust that whatever you do is correct. If you like, be the best doctor. You understand? So you must, this issue of I don't care, and look at your eyes, you must look beyond it. I don't care. If you want to consign me, if you like go, if you like come, you must look beyond it. First impression matters. And most times, scientists say that people look at you, they judge 80% of everything about you from your appearance. So your appearance matters a lot. The way you talk, your carrying matters a lot. A patient is assessing you, looking at you, and say this doctor doesn't know what he's doing. Even if, and you know that if the patient does not believe in your prescription, even if you give him the right drug, it might not work. They want to call psychology. If the patient feels that this drug will not work, it might not work. So you must remove all those bias, and the patient will go and tell that guy, you don't know what you are doing. Meanwhile, it's from his own side. So you must make sure that from your own end, you get it well. And from his own end, he's also getting it well, that he believes that whatever you are telling him is the best for him. But first, he must have confidence in you. And again, how do you have confidence in you from your appearance? You cannot be wayward on social media and say it's my social life, and then as a doctor, it won't work that way. Do you understand? I'm not saying you should be, what I'm saying that be responsible here and there. Your appearance speaks a lot. The way you comport yourself speaks a lot. Even if you don't know what you're doing, the way you carry yourself, you say, this doctor is like he's trying to bring out one new technique in town. Do you understand? So your confidence matters a lot. And confidence is built on knowledge. If you know, you have confidence. If you have knowledge, you have confidence. For instance, I can teach you without this thing I'm holding here. Without preparing, but I know this stuff. And I want you to also know this stuff. Do you understand? So your patient compliance is based on your case history, how you manage it. And again, there are also time taking. Some tests should not take more than some allocated time. If it takes more than that, they will begin to feel tired, or they will lose concentration. For instance, you are doing ophthalmoscopy for 10 minutes. What are you seeing? You want to see the vanilla or what? Ophthalmoscopy 10 minutes. You will shine. Okay. I heard one joke in one school. I will not mention anybody's school. Those what you understand. So they were teaching ophthalmoscopy, and then the guy's light was here. The patient was there. Say, I've seen it. His light was here. They say, I've seen the fundus, I've seen it. But his light was there. So imagine where you don't know what you are doing. Or you are shining the torch in the patient's eye for 10 minutes. And then you will not shine. Say, come and see. This one will not shine for 15 minutes. You have lost the patient. He will never come back. These are things they might not teach you in school, but you need to know these things. So time taking is important. You should not take so much unnecessary time to see a patient. Time is what? It's money. So you cannot be doing a retinoscope for 20 minutes. You are doing that for no. But then, as I know you are learning, it might take you such time. But when you get to the level of mastery, you understand, you will not be faster. But I'm talking to you as though you're already licensed and you understand. But I want you to have this at the back of your mind that when you begin to see patients, time is important. You understand? Are we making progress? Yes. Are you understanding me? Are you praying with me? Yes. I want you to be relaxed, because if you're not relaxed, you will not get this class. You understand? So, we talked about time taken, Adi. Yes. So, case history begins the moment the patient walks in. Hence, he or she is the most important personality, and this must be reflected in honor. So, the case history begins the moment the patient walks in. Remember, as you're assessing the patient, you're assessing you. Never forget that. You're not the one under assessment. He might not tell you, he's looking at you too. Because in case history, they are going to be giving confidential information. So the patient wants to be sure that if I tell this doctor now that I have HIV, he will not go and post it out, oh boy, stay safe over it. Stay safe in the window. He doesn't want that. He wants to be sure that if I tell this patient that I'm a widower, that he will not say, so, or if patient tells you that I smoke, you say, you smoke? Some people will tell you that I smoke. You say, you smoke. Yeah, I'm born again. We don't do that here. This is a professional setting. We keep religious sentiment aside. You understand? So, case history begins the moment the patient walks in. For instance, the patient walks in and you find out that he's bumping into things. What does it tell you? Peripheral view is compromised. So it begins the moment. Or the patient comes in and is like, where will I sit down? What does it tell you? Central vision is compromised. The patient comes and is like, this place is so dark, I need more light. He's doing his phone like this. Praise the Lord. So from the moment the patient enters, you should be taking your assessments. You understand? All these things will come together in having you to diagnose effectively. Do you understand? So the moment the patient comes in, case history has begun. Case history has begun. Do you understand? So, and then you must understand that the patient is the most important person during any exam. He's the most important person. And you must reflect this by honor and respect. A patient should not be talking to you and you're pressing your phone. I thought I said nobody should. I don't want to see anybody's phone. I said it. They are recording it. There's a recorder here. So, when a patient comes in, patient should not be talking to your friends, you are doing WhatsApp. Madam, sorry, sure, this is a vision. Let's say we will refer you. You understand? So you must be professional. You must reflect that it's important. And you not just say you should show it by giving you attention. So he's the most important person there. You understand? Even though some patients are very funny. When you now take them in high esteem, they want to mess you up. But still be responsible and let them know that this is their time. You understand? So the patient is the most important person in the clinic. And then there should be a sense of confidentiality between you and the patient. You understand? So if the patient is going to open up to you, you must know how to operate with people. If the patient is going to open up to you, you must learn how cases is done. For instance, I've told you that if the patient sees you as irresponsible, he will not open up. Is that correct? If the patient sees you as someone who is not down to earth or someone who is arrogant, he will not open up. So you must learn how to remove these unnecessary things. Because if you misdiagnose, nobody will want to know that it was because the patient was too shy. That's why he misdiagnosed. They will say you're not a good doctor. So you must learn to remove those little things that will not be in the folder to show that this is what caused it. You understand? So if the patient is going to open up to you, he is going to be judged on how well you appear, how well you communicate, and how well you listen. You understand? So, and patient education can also come in the process. When the patient knows that, this guy knows his stuff, he's more relaxed. Initially, when patients come for this thing, they are initially tensed up. But if a patient can come in now, and I see, and maybe for the better that I said I hobby, enjoy watching football. I just say, which club do you support? You say Chelsea. I say, I don't want that now. Chelsea people lose a lot. He's relaxed. We talk to people about football. You understand that, this guy is in. So find, before you begin your, why are you here? Where are you listening? What's wrong with your eyes? Find a soft spot of that patient and talk about it more. This is a tip I'm giving you. Before you begin to ask, what's your complaint? Find that you might look at the state of origin. See how we ask you, where are you from? Urata. You were now more relaxed. You understand? So she now knows that this is my brother, he will not harm me. Subtly, her brain has told her that, relax, we are family. For instance, if she comes now, imagine this is my patient now. I'll say, hello, where are you from? Inquiry. People have bad road there. I heard people have road. She say it's not true, it's not true. You understand? We'll just joke a little bit. She's relaxed. Maybe I find out that she likes cooking. I say, oh boy, you like cooking, me, I don't like cooking. How do you guys do it, sir? She begins to tell me about her passion. She's relaxed. But I'm not here to talk about cooking, remember. But I want to find a place, a way of making her relaxed. So that if I now ask her questions, she will open up. Because cases is opening up. You understand? But if the patient is not relaxed, the patient is tensed up. He thinks that it is question and answer. Who goes you? I go here. Who goes? You know that? Hey. No, it's not. That's not what we are doing here. So find a soft spot, either from the hobby, state of origin, or the name. You can see the name. My mother bears this name. My mom's name is Blessing. I see your name. Your name is Blessing, right? This is my mom's name. Yeah, like my mother. Even look like herself. She's relaxed. So these are the little things you need to understand. They might not teach you this in class, but as you begin to practice, find out that they help you become a better doctor. And most times when patients now come, they say, I want to see that doctor. Because of what? There is this bond between you and the patient. Do you understand? So don't just come and write off the patient. So now, these are just nitty-gritties of cases. Now let's begin the professional stuff. I hope you all understand where I'm coming from and where I'm going to. So now, what are the components? First of all, you need to introduce yourself to the patient that I am Dr. Wisdom, a licensed and professional doctor. So once you say I am Dr. This, patient knows that not really a quack. Don't just say I am Wisdom or I am Blessing. Say I am Doctor. He now knows that what his name is a doctor. Do you understand? So you introduce yourself first to the patient that I am Dr. This. You understand? And then you say, please have a seat. You must be polite and be welcoming. Not that you are looking, okay, how can I help you? Okay. So you are even chewing gum, sir. How can I help you? No, you should be polite. Please have a seat, sir. Remember, I'll talk about honor. Remember honor and respect. Please have a seat, sir. You can keep your bag here. Feel at home. You can even offer him a bottle of water if you have a drink. You can offer him a drink. So do you mind what? You know, understand? The patient feels at home. So, and then you introduce yourself. You exchange few pleasantries. You understand? If you know he's a Chelsea fan, did you watch your ball yesterday? Why did they remove Jackson at the 45 minutes? That guy, let's call it on goal. Coach, we go Saka. Then, you are not yet talking about football, remember. But it's an opportunity to make the patient work relaxed. You understand? So, exchange few pleasantries. I like your shirt. I like it. Where did you get? You don't understand. You understand what I'm talking about? Thank you. But then for the guy, it's not an opportunity to be flirting. Some of you overdo it. Yeah, you are fine. Give me your number now. You don't do that. Some of you can now overstep your boundary. You now say, okay, relax, Abby. You now begin to chide again. You are not there for chiding. You understand? You are here for a professional mistake. So then, once the patient is relaxed, seated, and you have his attention, you ask him, why are you here? So the first component of case history is what? Chief complaint. The first component is what? Chief complaint. So chief complaint is the reason why the patient came, or you can just write CC, chief complaint. So chief complaint is the reason why the patient came to the clinic. You want to know why he came, why he or she came. So you can ask questions like, what is the reason for your visit today? How can we help you today? You understand? Why are you here today, sir? What is the complaint with your eyes? Some people, you ask them, why are you here? They say, my eyes. We know that. Why are you here? My eyes, oh. You understand? So, chief complaint, you want to know why. Like, I had a patient, he came, where I'm working, he came for dental, for teeth, but where I work, dental and eye, they are together. He came for teeth, but open folder for eye, not knowing. And then after waiting, I was to see him. I said, why are you here? His teeth is paining me. And I was like, okay, it's paining, okay, sorry. How can I help you? That he wants to move it. I said, sir, this is eye clinic. Not, So imagine I didn't ask why you're here. And I'm doing ophthalmoscopy, I'm doing VA, I'm doing everything, refraction, everything. And I said, sir, you need to get glasses. Say, glasses for my teeth. You've lost it. Do you understand? So you need to know why the patient came. And be sure that he came for the right reason, for eye. Do you understand? Are you with me? Are you following the class? Yes. So chief complaint is the way of knowing why the patient is there. So the patient tells you that I'm having blurry vision. You know, you are reporting it's a reported speech you are giving now. You can now begin to say, patient complains of blurry vision. If you end it here, you have missed it. So patient told you that I can't see, I am having blurry vision. What do you need to do now? Is it at far or at near or at intermediate? You need to know. So you must be detailed to find out this blurry vision, is it at far or at near or intermediate? When did this blurry vision start? What caused it? Does it happen in the daytime, in the afternoon? All these things will help you in your diagnosis. Don't just go and write blurry vision. Okay, blurry vision, I'll be okay, take one step. No. Do you understand? So patient tells that he has blurry vision. Find out, is it at far or at near? For how long? Is it in one eye or in both eyes? Do you understand? Do you understand chief complaints? Do you understand chief complaints? Yeah. So that's what you want to find out in chief complaint. That's why the patient is there and what is happening. So you write it that patient complains. This is an example I'm giving you now. Patient complains of blurry vision. Then I went further to ask, is it, you now said that it's at far, right? At far. For how long? He said for about 10 years. This 10 years should make you pay something. You mean you have been having blurry vision for 10 years. And maybe the patient is maybe 18 years, for instance, which means for more than half of his life, he has not been seeing well. Do you understand? Now, with this information, you can get a lot from that. Someone that has not been seeing well for the past more than half of his life, it should tell you a lot. What the one thing they can tell you? What the one thing they can tell you? Amblyopia might be setting in. You know what amblyopia is? Yeah? Amblyopia might be setting in. You understand? So every information gotten has a link to somewhere. Don't just write off any information they give you. The patient you can even for the patient appearance and say, sir, you have trouble, what is the issue? He now tells you that, oh, I have been diagnosed of diabetes I have been having diabetes for 15 years now. That for 15 years, what does it tell you? Diabetic retinopathy. Abi? Which means if you are doing ophthalmoscopy, you should pay attention to the fundus. Because in diabetic retinopathy, we are seeing what? There's a non-proliferative and a proliferative stage, right? The non-proliferative, there are about 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1, microaneurysm, Sabi? People are looking as if I'm talking. Okay, I'm 200 levels, sorry. I'm overstepping my boundary. But you are not looking at, if you are looking at the non-proliferative stage, you are looking at cortical spots, hardest base, softest base, all those stuff. Then if you are looking at the proliferative stage, you are looking at neovascularization elsewhere and neovascularization of the disc. You understand? So he told you that he has diabetes for 50, that's why he's worried. A good doctor should not question, this 15 years of diabetes, are you managing it? I know that diabetic retinopathy will set in after 10 years, right? Sorry. Let's continue what we are doing. So where am I? So chief complaint, right? So you should ask open-ended question like, what is the reason for your visit today, Sama? You understand? Then there's what we call FODAQ. It will help you to isolate your chief complaint well. FODAQ is FOLDARQ. F means frequency. O means onset. L means location. D means duration. A means associated factors. R means relief. And Q means what? Quality. So, if someone tells you that I'm having this complaint, you want to ask the frequency. How often does it occur, right? You understand? How often does this thing occur? You are not asking, so he tells you that he's having this complaint. Remember, for that in your head. You now ask her, how frequent does this thing happen? He tells you, you notice that. And then you ask him the onset. When did this thing start? Was it yesterday? Was it today? Was it last month? Was it last year? Do you understand? And let me give you a little tip. Vascular oriented issues usually last for seconds. Vascular, what is vascular? No. Usually last for seconds. Traumatic oriented issues will last from seconds to hours. Trauma, what is trauma? Then inflammatory oriented issues usually last from minutes to days. Now what I will send you the lecture notes when I'm done. So just listen to me. I will find a way of sending you the lecture notes if I have the time. And then chronic stroke degenerative issues, they last from minutes to months, possibly years. Then elevated intracranial pressure. What's intracranial pressure? The fluid in the brain. It usually lasts from minutes to years. Do you understand? Then we come again. Vascular oriented this thing, they usually last for seconds. Traumatic oriented cases usually last from seconds to hours. Then inflammatory, this usually lasts from minutes to days. Chronic degenerative. Example of degenerative condition.
Macular degeneration.
Degenerative. If present a disease. Is present a disease? Is present a refractive condition?
No.
Is it a disease?
No. It's a condition.
Example of degenerative condition or disease. Age-related macular what? Degeneration. For example, do you understand? So that is that for the onset. Then you want to also note the location. The person is having headache. You ask, where you are experiencing the headache? Please pay attention. Is it frontal? Is it temporal? Is it occipital? You understand? You want to know the location. You understand? You want to tell you that I'm having pain. Find out where's the location of this pain. The pain could be in his leg. I came to eye clinic. I had there treating, giving him all the pain relief. Meanwhile, the pain is in his leg. Ask him where are you feeling this pain. You understand? Then that is the location and the duration. How long does it last? This headache you are having, how long does it last? Does it last for 1 hour or just few minutes or few seconds? You know, the time it lasts can tell you whether it's migraine or stress related. You understand? Do you know? That is topic for another day. Then the associated factors. If you are having this headache, does it come with blurry vision? Does it come with pain? Does it come with total blackouts? You understand? You want to know what it comes with. This is your blurry vision you are having. Does it come with headache? So you want to know those things that accompany the blurry vision. Do you understand? And then the relief. What relieves this your complaint? It could tell you that every time I use my system, I'm having headache, but when I close it, I get relief. You note it down. It will tell you that when I'm in the sun, but when I come out from the sun, I get a relief. So you now know that your sun is triggering it, and out of the sun gives it relief. Or just that every time I have headache, I take Panadol, it resolves for a while, and it comes back. What is it telling you? That headache is not headaching. It is eye related, because you take Panadol, it resolves, and after a while it comes back. And then the quality. If you can grade it from 1 to 10, where will you grade it? Some people can exaggerate. And some people, they have ability to handle pain. So even if they are in hellfire, they are still smiling. So you want to grade it for them. Let them know, is it from 1 to 10? Where will you grade this PR? Is it 1, 8, or 9 or 10? Do you understand? Do you understand? So I know you have questions, but when I'm there, you can ask your questions. Then quickly, let's fly, because I need to travel today.